Welcome to MS Unmasked, Our Journey and Beyond, a podcast where hosts Justine Martin and Allyson Brown share their personal experiences, insights and practical advice on navigating life with multiple sclerosis. Each week they delve into topics such as self-care, nutrition, exercise, sleep and symptom management. Join them as they explore the physical, emotional and mental aspects of living with MS, providing a supportive community for listeners touched by this condition. Get ready to be inspired and empowered on this incredible journey through MS Unmasked, Our Journey and Beyond.
Welcome back, listeners, to MS Unmasked. Woohoo, Allyson, I got the name right this week.
Yay! No brain farts today yet.
Woo, yes. Don't jinx me. How are you going?
It's not just you. It happens to all of us, right? I was having one the other day. I was trying to explain something and all of a sudden I just went blank and I was like, come on, brain, you know the answer to this. Like, what were you talking about? And then I get really stumped and then I'm like, what were we even talking about? And yeah, it's...
What meeting was it? Was it important?
No, it was...
Because I had
actually,
one on Friday.
I think it was at the Small Business Festival the other day when I couldn't come to the writers group. Yep. I was at a Pilates class and, yeah, they were just asking me a few questions and I kind of just went blank halfway through and went, what was I talking about again?
Well, I've made it into the Geelong Business Excellence Awards, as you know,
Yes.
and Leader of the Year and Resilience Mindset and Just Art have all made it in there as well. And you have to be judged for it. So on Friday was the judging for Business Leader of the Year. And you get half an hour, 30 minutes to tell your story on why you should win Business Leader of the Year and you know, what your leader capabilities, you know, blah, blah, blah were. And I was going really, really, really well until one of the judges made a comment or a word, or she did something, and then it was gone. Totally gone. No idea what I'd said, where I was up to, none of it. And I'm like, oh, you're going to have to excuse me. I don't know where I'm up to. I don't know what I was talking about. That would be a cognitive impairment that I do have. And then lucky one of the judges was listening to where I was up to. And, I picked it up. I'm like, oh, yeah, that's right. Okay. Blah, 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 blah.
Yeah. And usually people are pretty good. Like, they understand. Usually if you sort of just tell people, make a little bit of a joke about it and kind of go, oh, sorry, I just had an MS brain fart moment. Sorry, what was I talking about? Like, people are pretty good and they'll understand and help you out. But yeah, it does happen.
Yeah, that's how I normally start my talks. If I go on, and you've been there when I've said this, that when I'm doing a big talk, and, you know, there could be 1,000 people in the auditorium or 2,000-3,000 people I'm standing up in front of, and it's like I'm going to lose track of where I'm at. And it could be just someone's got up and gone to the toilet and I've watched them and then it's gone. And I'm going to need you to really concentrate and listen where I'm up to, because I'm going to pick on one of you to refresh my memory. And you can all see them go, oh, God, I hope she doesn't pick me.
That's good, though. It kind of is a bit of an icebreaker too, as well, I find. So, yeah, it's okay. And, you know, look, if anyone's listening and they're like, oh, my God, I get that all the time, don't worry. It happens to the best of us, but it's okay.
We call them MS brain farts. So if you've never known what to call them, there's a word for you to call that. So I'm stoked I got the intro right today. It still takes a bit to process because I do 3 different podcasts. It's like, oh, which one am I doing today? Which one's this?
It's okay. It's okay. You are forgiven. I'm sure our audience forgives you. I forgive you. It's fine. It's okay. It's okay. We're in a safe space.
We are in a safe space. What are we going to talk about today in our safe space?
I think we were just reflecting on some old sort of experiences that we've had. And I think you started telling me before going into it, before I introduce it, you tell me what your sort of story was. I think you said that you woke up and your feet weren't working. Is that right?
Yeah. So I woke up in November 2017. My long-term memory works pretty well, where my feet were on fire so bad with nerve pain that I couldn't even walk from my bed to my ensuite to go to the toilet.
Just what does nerve pain feel like for people that haven't maybe experienced it, or they're experiencing symptoms that like, I don't really know whether I've got nerve pain or not. What does it feel like to you? Because I've had it before as well. What does it feel like to you sometimes?
I get different types of nerve pain as well.
For sure.
So sometimes the nerve pain in my feet will feel pins and needles, and then pins and needles on steroids, that it's not actually needles, they're daggers that are going in and out. I feel sometimes that I shoot out electricity out of my toes. They're just like if I could have a superpower, that would probably be one of them. Put me in Marvel any day, or DC. That they burn, they're hot and they burn, but they're cold to touch.
Yeah.
And touching is another thing that when that sensory, I'll be sitting on the lounge at night and then all of a sudden my left foot, on the top of my left foot on a patch that's about 10 centimetres across, will just ache and be on fire, and I've got to get that shoe off immediately. And then there's this big round red patch on the top of my foot from it. So it changes. There's no consistency either with it. I think
mine was like the worst I've had is the feeling of like razor blades cutting me. Even if
see, that's every day for me in the shower.
Water
running down, just the trickle of water is
it's the softest touch.
Yep,
softest touch.
A razor blade and they're slicing through my legs.
Yeah, and I'm sure some of the listeners are like, oh my God, yes, I totally understand.
Or ants. Yep. Ants running across, something creepy crawly running across your skin. And I'm like, you'll see me quite often. I'm always on my face because I feel like something's crawling, like a spider's crawling up my face all the time on that. But
I remember going to the neurologist and I said to him, because it's really hard. Have you ever gone to the neurologist and you're trying to explain a feeling?
Yeah.
Right. How do you put these into words? Because some of these things are like so kind of strange. I remember going in, one of the first times I went into the doctor's and I was trying to explain what the symptoms were. Fair enough, I had leg weakness, which was pretty easy to explain. But I said to her, these are my almost exact words. I said, I don't know what this is, but it feels like I've had like a child or an animal or something that sat on my leg, my thigh, and peed on me because it feels hot and wet, but I don't know how to describe it any better than that. So you try to find these words to actually describe what's going on, but it can be really, really tough. And I remember just trying to find the words to explain as best as I possibly could so that, a layperson, somebody could just understand what I'm actually experiencing, because it's really hard to put into words.
It's extremely hard to put into words. 100% hard to put into words. And this one particular day in November, I had done way too much from it, and I went to bed the night before and I wasn't well. I had a very sore throat and just so run down. So I was at the end of my chemo as well and had done way too much stuff, and my immune system had just crashed, and I woke up very scared because even just the sheet and the blanket on my feet were excruciatingly painful. And then I went to stand up and I knew that I was in trouble, and I was at home by myself and just screaming, walking to get to the toilet, and it's about a 2-meter walk, 2.5 meter walk. So it's not a long distance, but it felt like running 100-meter mile. And that makes no sense. 100-meter mile. That's a bit confusing.
All right.
And
I know what you're talking about.
Yeah, a long way. Then I got on the toilet, and I remember sitting on the toilet with my feet like kind of hanging off the ground, and then went, how am I going to get back to bed? And then managed to get back to bed, and it got worse. And I'm like, I'm going to have to call an ambulance from here. So I rang an ambulance, and they came quite quickly. And I had a bedside drawer full of medication. Absolutely. So there was endone, there was, you name it, the drugs that were sitting in that drawer.
So endone is a very powerful painkiller.
So it's the one below morphine. And I couldn't take any because my throat was so sore and I couldn't swallow anything. And the ambulance, and I had scripts sitting on my bedside table as well that weren't filled. And the ambulance turned up and they instantly prejudged me as being a prescription junkie. Instantly. And I knew they'd got that impression. And because everything that I was experiencing, you couldn't see. I looked normal, except for I was looking a bit grey. And if they'd bothered to look in my throat, which was bright red, they would have seen that there was a problem there. And anyway, when I bought my house, I bought it looking at the size of the hallway, the doorways and everything for a wheelchair, and that if a stretcher needed to come in and out. Now, they turned around and told me that they couldn't get a stretcher in the house. All right. And that I would have to transfer into a chair, and they'd wheel me out on a chair, and then they could put me on the stretcher out the front. So they made me stand on my feet again in my bedroom and put me in this tiny little wheelchair thing, and then got me down the steps. Then brought the stretcher up to where my front steps are. If you ever come to my house, I don't have flat cement there. I have that pebble cement. You know, the ones with the aggregates all shiny.
Yeah.
Yep. So it's like not slippery. So that's at the front, and they made me stand on that with my feet. Now, I was
standing on Lego.
Yeah, I was screaming in pain on carpet. You can imagine what it was like standing on, Lego. And just, crying and screaming, trying to get onto this trolley. They still refused to give me any pain medication for it, wouldn't give me anything.
Mm-hmm.
Then on the way into hospital, my blood pressure must have been through the roof because of the pain that I was in. Then they decided that they'd give me some fentanyl, which didn't work because it's nerve pain. Fentanyl's not going to work with nerve pain. And still didn't really believe me that there was anything wrong. Got me into emergency. I was in emergency for ages and they were checking me out. The doctors there and the nurses there prejudged again and didn't believe that there was anything wrong. Until a nurse went past, and I'm very tall, so my feet hang over the end of stretchers, and she bumped into my feet, into one foot. And I let out a scream that was not something that I could actually physically control. It just came out from the amount of pain that I was in. That sounded like someone had just murdered me.
Yeah, wake the dead kind of scream.
Wake the dead scream. And all these people stopped and turned around and looked at me. So it was very embarrassing. But then they realised, so there's a difference of a scream of when someone's putting a scream on and to when someone's actually in full pain. And I'm pretty sure they're trained to know that scream. And then all of a sudden they started taking me seriously, that there was something wrong with my feet. And I kept saying to them, there's something wrong with my throat. And they kept ignoring my throat. And then because I was a cancer patient and a neurological patient, they couldn't work out which ward they were going to put me into. So they ended up putting me into the neurological ward and forgot to tell my cancer specialist that I was actually in hospital, and then put me in a ward with someone who had pneumonia. And I was neutropenic, which for the listeners, that means that I had no white blood cells to fight infections. And here I was in a room with someone who had pneumonia. And so, the doctors and the nurses came in and I went, I'm not meant to be in a room with someone that's got infection. So this is prior COVID and, before everyone knew all the dangers and everything. But they should have known. And they went, oh, your bloods were fine this morning. I went, you didn't do my bloods today. You haven't done my bloods in 2 days. So then about half an hour later, the next thing, he got shipped out of that room. And then that night I got someone else that came in, and that person, right, they were kitting up and masking up to deal with her, but I was in the room with no face mask on. Yeah.
Makes no sense.
No sense. And then she got shipped out, and then they came in with what I call the SWAT team, the cleaning SWAT team, who were fully like white kitted up and masked. And I was in the bed closest to the window that didn't open, right? And they were cleaning it all. And I'm like, I should not be in this room at all. And by that stage, they'd worked out what had caused my feet. Now, when I get an infection in my body, it throws my MS out, totally throws it out. I don't know about you and your MS, Allyson, but with me, any infection or raising body temperature, it reflares.
Yeah.
All the old scarring in there, they become inflamed again. And that's what had happened, but it was just, 1,000 times worse than what it had ever been.
Mm-hmm.
And I kept saying to them, there's something wrong with my throat. There's something wrong with my throat. Anyway, when the SWAT cleaning team came in, I went, I'm discharging. Now, I was on a walking frame by that stage, and I was waiting to go into rehab because I had to learn how to walk again. I couldn't walk, and my toes were hooked under, and it was horrible. And besides being assaulted in hospital that visit as well, I got assaulted by another patient who beat the shit out of me. But that's another story about that.
Wow.
And I just, like, the nurse came in and I went, I'm discharging. She goes, you can't leave. I said, you just watch me. Yes, I can. And where's the paperwork? I want to sign it. Now, I'd rung my support coordinator at the time, and I won't mention where they're from, and I said, do I have enough funding? So I was plan managed at that particular stage and had the support coordinator, so then you don't worry about, your funding or anything like that. And I said, do I have enough funding there, and can you organise people to come in and look after me? I want to go home. I need to go home. I'm going to die if I stay here any longer, which is a terrible thing to say about hospital. But no one knows our body better than what we do, and they kept putting me at risk in high-risk situations, and it was horrible. Anyway, it turned out that I had laryngitis, acute laryngitis, and I discharged myself. I ended up getting into my normal GP, who looked in my throat, and I had pus nodules all down my throat. Put me on, because they wouldn't give me antibiotics in hospital, put me on large dose of antibiotics. Within a week, my throat had cleared up. And then it took about another 2 months for my feet to come back to that I could actually go for a walk without being in excruciating pain. I'd take, like, even just to go to the shopping centre, I'd have to take my wheelie walker so I could sit and take the pressure off my feet from it. So, I mean, I've got a few other horror stories, but you've got to stand up for your rights. You've got to know that, if you're in hospital or if you're seeing a doctor and they're not listening to you, you have to stand up for yourself. So no one's going to stand up for you.
Yeah, absolutely. I remember, because I've had about 20 relapses, so I've had, each of those times I would have had methylprednisolone, the usual treatment, which is a 3-day course. So I've had a lot of that. I remember a few times they put the cannula in, they got it all ready to go, they hooked it up to the methylpred, and then they'd start the pump to pump it through my body. A few times I remember just saying to them, sorry, but I think it's actually maybe pumping into my skin. Like, I don't think it's actually pumping into my veins. Mm-hmm. And they're like, no, like, they'd have a look and they're like, I think it's fine. It's fine. I'm like, pretty sure. that it's going into my skin, into my flesh, and it shouldn't be.
Isn't that painful?
It's so painful. But the problem is, I'm
Did
not
it get you in your shoulder?
dramatic. Like, I don't scream out in pain.
Yeah.
I don't. I tend to be kind of mellow in the sense that if something's wrong, I'll be like, I'm pretty sure something's wrong. I will just state it like that. So you can imagine that the hospital staff are like, yeah, no, I think you're fine, because you're not making a big song and dance, right? And then a few minutes later, it's still pumping into my body. And what happened was this big lump started to form under my skin. It was very obvious that it was pumping in. And I called them back in and said, yeah, no, it's definitely pumping into my skin. See? And they looked at it and they're like, oh, yes, no, that's not right. And they had to fix it. But it's one of those things where you know your body, right? Nobody else knows your body like you do. And those kinds of experiences, like, you really just need to speak up. If something's not right, if something doesn't feel right,
then it's not right.
It's not. Yeah, that's right.
I had one where they just put a saline drip in, so it wasn't, anything like really important. And I said to him, it's not in right. Oh, yes, it is. Yes, it is. I'm like, no, I'm telling you now, it's not in right. And within an hour, the pain in my shoulder of what it had done, and they've come in and my arm had just swollen up, and they're like, oh my God. I said, I've been trying to tell you it's not in right. So when they're taking blood from you, and I'm like, no, you've missed the vein. Oh, no, we're in. No, I'm telling you now, that's hurting. Shouldn't hurt. Taking blood should not hurt.
Well, to a certain extent, for sure. Like, obviously, there's a bit of a thing, but it shouldn't actually hurt you to suck that blood out. Like, it shouldn't feel. You shouldn't feel anything really in that space.
They should get it in first go, and that's it. Like, I've been jabbed 9 times.
Mine was 13, and I've seen somebody else that was it 15? They had a few more times than I did, and by that stage, the nurses actually went, okay, we need to get the doctor in. And so the doctor had to come in, and, this was the person's first time ever having an infusion for MS. So he just got diagnosed. I felt so bad for him. I was at least a bit of a seasoned, I'd been in a few times already. So I sort of understood that maybe they don't get it the first time. But surely there's hospital policy that says after 3 attempts, you need to get somebody else.
It's now, I know.
Well, it isn't, because it's like 13 times, I'm telling you.
Well, in Landrew Love, where I was, it's 2 now.
Yeah.
They changed the policy at BMI because of this experience that I'd had having an MRI in there when I was, and that led to me getting claustrophobia. They had me lying on the MRI bed, head locked in the cage, and trying to get a vein, and blew a vein out while that was happening. So all my hospital records now say hard to cannulate, get her in early.
Yeah, I was going to ask you about that, because I feel like I'm blacklisted. I do feel like I've got tiny little veins that are very selfish, that like to hold on to their blood. Yeah. And so my circulation isn't very good. So unless I'm actually feeling warm, my veins are going to be like, even if I've drunk heaps and heaps of water, it can be really hard. It can be really hard for them to find veins. So I do try to kind of explain it. Like, I don't want to tell somebody how to do their job at all.
No.
They're experts in this field, but I do try to tell them. It can be a little bit difficult, and try to point them in a direction to go, this vein is actually a little bit better than others, so maybe try that one first. Some people definitely do not like hearing a suggestion. Other people are like, yes, please tell me which one works, because I'll go for that one first. But honestly, like, if you're getting bloods done through something like pathology, they do bloods all the time. Yep. They're amazing. They've only missed like a couple of times in the whole time I've ever had blood tests. They're really, really great. In the hospital, it's a little bit different. They've
Well, they now have these machines that you can put your arm under and it will actually show, not an ultrasound machine, but it's this other machine, and it shows all where your veins are.
Yeah, and the lady who I spoke to last time, she said that they now have the policy where they do 3 tries and then they have to use the ultrasound guided procedure so that they can find exactly where the vein is. Yeah. Which I think is great, because I don't think, like, I feel really bad for that guy that it was his first time and he had something like 15 jabs. And, it got to the point where, because obviously 13 jabs is what I had. So you're blowing out this area, you're blowing out this area, you're blowing out this area. So all of the usual areas are blown out. What they actually said to me was the doctor was actually going, oh, we might get it in here between your knuckles, in your hand, between your 2 fingers. Oh. And I was like, oh, no, it was on my toes. Sorry, it was on my toes. And I was like, really? Like, surely there's other places, like just cut my arm off and that will be easier than getting that done. It sounded disgusting. Like, just go between the toes, in between the knuckles. I was like, no, please don't do that.
Because I've got none on the backs of my hands at all. I've woken up from theatre where there was one operation, this is years and years and years ago, where they kept trying to get in through the back of my hands, and I had 3 cannulas in this hand and 5 in this one, and they still couldn't get in them. Horrible experiences with it. So, and I think they forget sometimes that they're actually dealing with alive human beings when they're doing.
Some of them can, but Alex, honestly, some of the nurses, most of the nurses, I would say, most of the nurses that I've ever dealt with have been amazing. They do their best. They absolutely do their best. They try really hard to make sure that it's not hurting you. Like, they're aware that it is. You end up as a human pincushion otherwise, right? Yeah. And they know that that's not where they want to be. They don't want you to actually experience that. So usually they're amazing, but occasionally, I've had somebody that doesn't give a flying hoo-ha.
Yeah. And it's like, you really need to find a different job.
Yes.
You've been in this one a little bit too long and you've lost your compassion.
Yeah, that's right. It really just is like a numbers game, or your patient XYZ. And I just feel like it's unfortunate, because you're right. Like, if they're in that sort of space and they're dealing with human beings on a daily basis, the last thing that we need is somebody that's not showing compassion and empathy and, caring that we're in a lot of pain, we're in distress, our body's not working properly. Please show us a little bit of kindness, because it goes so far. It goes so far.
It does. And, and that's your whole medical team as well. I mean, you've got to have a medical team that's backing you. They work for you. You don't work for them. They are there to help you. And if there's something that's not aligning with you, or you don't feel that it's right, then go and find another opinion.
Yeah.
If I'd listened to a GP that I had in 2016, I'd be dead today. Because she told me that the rash that I had, so I was going purple, was nothing to worry about, and come back in 3 to 4 months if it was still happening. Now, what she actually missed were 3 primary cancers and 2 blood conditions. So GPs are general practitioners. They're not specialists. They're not qualified for everything. I'd obviously gotten in the too hard basket for her, and she wasn't aware of what actually was happening. Now, my liver count had been out for years. So my blood test kept flagging that there was something wrong with my liver. And my white blood cell count was out. But they kept putting it down to the disease-modifying therapy drug that I was on, and that can change your liver levels. And so no one had investigated further into it. And as it turned out, I'd probably had that cancer for 4 years prior to them diagnosing it. Which led me to having 3 heart surgeries that they could have fixed with chemo rather than having the surgeries, because the heart what was wrong with my heart was actually a byproduct of one of the cancers. but no one investigated that either.
Yeah.
They were quick to put me under the knife and quick to dismiss things instead of investigating into it. And, I take partial responsibility from that as well, that I didn't push for further answers, because I kept saying, I'm 40, early 40s. Why is this happening to me when I should be a male in my 70s with what was wrong with my heart? I don't fit the gender and I don't fit the age group for it. No one could give me answers.
Mm.
No one could.
Does it make you feel like a hypochondriac?
Yes. Oh my God. And then like telling my family as well, it's like, oh, this is wrong now. Oh, this is wrong. And, just even going to the doctors now, I go in and say, look, I think there's something else wrong. This is happening on my body. And, if I had a doctor roll their eyes at me, I'd just get up and walk straight out. But I do have a very kind and compassionate medical team behind me now, which has taken a little bit of work in finding and interviewing as well, because I interviewed for a GP, which might sound particularly strange, but when I rang up, I asked to be put in with a GP that had MS experience and neurological conditions, because I didn't want to have to be sitting there educating them.
You need to have somebody that's competent, that understands, but also shows compassion. Like you need both. You need both. And I hate that feeling of people, judging you that, you're making it up, or that you're a hypochondriac, or that you're taking it too far, and like, you're fine. Like, look at you. You're walking and you're fine. I don't see anything wrong with you, so there's nothing wrong with you. That sort of judgment, I suppose. But I don't take the judgment to heart as much these days, because I do know my body, and I am actually okay with being a little bit cautious. For example, if I get a lump somewhere, I go and get it checked out. I don't even care whether it's just a little fatty cyst or something like that. I'm like, if there is a lump in my body that shouldn't be there, I want to get it checked. So I can seriously walk into the doctor's 5 minutes one day. They went, oh, that's just a little fatty cyst. It's fine. Mm-hmm. And I went, oh, is there anything else we can help you with? Oh, no. Okay. And then
my question always is, how do you know it's just a fatty cyst?
It's true. And then
they'll send me for an ultrasound.
And look, you know what? I'd rather be safe than sorry, because obviously from what you explained today, if you didn't follow those things up, if you didn't get an extra opinion or get an extra test done, you might not be here. Like, and that's serious.
Well, by the time they diagnosed me with the cancers, I was stage 4. There is no stage 5. Yeah. And then I had a fight on my hands in trying to stay alive, and my body was shutting down, and that's the thing with MS as well, that it's not always MS that's going wrong in your body. There's so much more that you can still get, unfortunately. MS doesn't give you this barrier that everything else is going to stop, and there's a lot of conditions that now they realize that can go hand in hand with MS. So bipolar being one of them, depending on what, cognitive issues that you actually have. Parkinson's and MS team up together, unfortunately, as well. So there's quite a few that don't blame everything on MS.
Yeah. And look, from my research, what I know about, what causes autoimmunity to kind of rear its ugly head, and a lot of other chronic diseases as well, is to do with a poor gut health. And, a big contributor to that is obviously diet, but there are other lifestyle factors, as we've talked about before, like stress and whether you exercise, whether you get enough sleep, all these things. But if it gets what I call it is like the perfect storm. If it's the perfect storm for something else to arise, guess what? Boom. And when you've already kind of got that, gut dysbiosis, this disbalance in your gut, you're more prone to getting something like Parkinson's or getting a secondary autoimmune condition or a third. You know, there's lots of people that are like, yep, got my third autoimmune disease. Thank you very much. And it's because most of those underlying factors are just triggering something new to actually happen as well. So you've kind of got to look at that sort of root cause if you want to try to get on top of it as well.
Yeah.
But yeah, it's stressful. It's really, really stressful.
Very stressful. And there's no quick answer and quick fix to any of this. They find us a cure, and there might be.
Well, one of these days, maybe, but we can just do what we can in the meantime to live our best life, right?
That's
to
right.
try to be as healthy as we can for as long as possible. Definitely, like, obviously, my background's now in nutrition. So my big thing is like, fix your diet up. That'll actually really, really help. And that's for everybody, like irrelevant of whether you have an autoimmune condition or cancer or you're a healthy, human being. If you fix up your diet, you'll actually get some health benefits as well. So it's never going to be a bad thing.
No.
I love that saying. It's like, I regret eating healthy, said no one ever. Because, eating healthy is always going to be good for you. You're always going to feel better for it. So
that's exactly right. Well, Elle, we might wrap it up there today. We're over our half an hour mark.
Yeah, no worries.
That time go, considering we didn't know what we were going to talk about.
Well, that's the usual kind of thing. But, we sometimes just work it out and gas bag.
So if you're out there in listening land and you really would like us to concentrate on a topic or a question, just fire them in at hello@justinemartin.com.au and we will address it in our upcoming editions. So, Allyson, any final words?
I just look forward to our next session talking about something really, exciting and meaningful to everyone, as always.
We'll work out what that is and until next time. So, listeners, I just want to also mention that if you would like to register for the pre-sale of Whispers of Resilience, our MS stories, the link will be in the show notes, or you can go on to resiliencemindset.com.au and register there. So it's coming out in 4 weeks' time. So it's a very exciting time for both of us.
Exciting. Oh my God, I can't wait till I actually sort of get a physical copy of it so I can see. But I'm really, really excited. 4 weeks. Amazing.
Yes, 4 weeks. Can't wait. Anyway, listeners, until next time, you all stay healthy.
Are you ready to be inspired? Get ready for the book that will touch your heart and ignite your spirit. Whispers of Resilience, Personal Stories of Living with MS is now available for purchase. Have you ever wanted to peek into the lives of individuals who have triumphed over adversity? Look no further. This highly anticipated anthology brings together a group of exceptionally talented authors, all living with multiple sclerosis, who share their personal journeys with unyielding honesty and vulnerability. At www.resiliencemindset.com.au, you can now secure your copy of this remarkable book that captures the essence of resilience, hope, and the power of the human spirit. Dive into the stories that will captivate your imagination and open your heart to the triumphs and challenges faced by these courageous individuals. With each turn of the page, you'll witness the unbreakable spirit of these authors, as they navigate the unpredictable terrain of MS. Their words will inspire you, uplift you, and remind you of the incredible strength that lies within. Visit www.resiliencemindset.com.au now and embark on a transformative journey through the pages of Whispers of Resilience. Get your copy today.